Hello dear friends, it's hearty and warm welcome once again. Dear friends, in our today's lecture we are going to learn initially about the coronary artery diseases, that is CAD, and later on we shall discuss about a diagnostic technique, that is angiography. So first of all, let us talk about coronary artery diseases. It can be abbreviated as CAD, C-A-D, CAD. Now, before discussing about these different coronary artery diseases, let us talk briefly about the coronary arteries, coronary circulation. Friends, while studying the structure of heart, already we have seen the heart acts as a pumping organ of our blood vascular system, and the heart wall is made up of cardiac muscles. Of course, due to very efficient contraction and relaxation of cardiac muscles, the rhythmic contraction and relaxation of heart is possible. It is necessary for the proper circulation of blood throughout the body. Now, for the efficient working of the heart muscles, for the efficient working of the cardiac muscles, it continuously requires the supply of oxygen and nutrients, as well as it requires the carrying away of carbon dioxide and metabolic waste materials. Now, please look at the diagram. Here diagrammatically I am going to show. Suppose here I have shown four chambers of the heart, such as the left auricle, left ventricle, right auricle and right ventricle. Now we all are aware, from the left ventricle it arises such a largest blood vessel, that is systemic aorta, and also we have studied that this systemic aorta is further divided into three main regions, such as its initial part is called ascending aorta, this middle part is called systemic arch, and this descending part is known as descending aorta. Now, from this initial part of systemic aorta, it arises coronary arteries. These are thinnest blood vessels, coronary arteries. Actually, there are three main coronary arteries, such as, let me show. Left coronary artery, here I am going to show left coronary artery. Of course, it has many branches and sub-branches. Then another one is left anterior descending, which can be abbreviated as LAD. This LAD is considered as most important type of coronary artery because it supplies blood to the major part of anterior wall of heart, and therefore any damage to the LAD is quite dangerous. And the third major coronary artery is known as right coronary artery. Here I have shown the three major type of coronary arteries. Now, what is coronary artery diseases? I told you that the coronary arteries, they supply oxygenated blood with oxygen and nutrients to the heart muscles, to the cardiac muscles. या ज्या coronary arteries या ठिकाणी मी दाखवलेल्या आहेत, त्यांचं मुख्य कार्य आहे की हृदयाच्या स्नायूंना, कार्डियक मसल्सला, हार्ट मसल्सला ऑक्सिजन आणि न्यूट्रिएंट्स, ग्लुकोज याचा सातत्याने पुरवठा करणं. And there are also presence of coronary veins, which may be simply called as cardiac veins. They carry away the deoxygenated blood. That is, they carry away the carbon dioxide and metabolic wastes from the heart muscles. Now, whenever these coronary arteries are damaged, either one or many, any damage or diseased coronary arteries lead to the coronary artery diseases. So what are coronary artery diseases? Coronary artery diseases are caused due to any damage or disease to the coronary arteries which supply oxygen and nutrients to the heart muscles, cardiac muscles. ज्यावेळेला या असंख्य coronary arteries अर्थात प्रमुख किंवा त्यांच्या ब्रांचेस या कुठे डॅमेज होत असतील, डॅमेज झाल्या असतील किंवा त्यांच्यामध्ये काही प्रॉब्लेम निर्माण झाला असेल, त्यामुळे coronary artery diseases हे डेव्हलप होत असतात. Actually there are two main types of coronary artery diseases such as angina pectoris. Angina pectoris and second one heart attack. First of all, let me tell you angina pectoris. Angina pectoris literally means pains in the chest. The literal meaning of angina pectoris is pains in the chest. Let me tell you, actually angina, this term is derived from Latin term angine. It means to strangle or to squeeze. And pectoris, this term is also derived from the Latin term pectus. It means chest. So the literal meaning of angina pectoris is the strangling feeling in the chest region. Strangling feeling. Strangling means the squeezing. Whenever that person, that patient feels the squeezing or strangling in the chest, it is referred as the angina pectoris. अर्थात छाती आवळली गेल्यासारखं वाटणं असा त्याचा शब्दशः मराठीत अर्थ होतो. Now this angina pectoris or such type of strangling or squeezing feeling in the chest is mainly due to the improper supply of blood. Not enough supply of blood, not enough supply of oxygen, glucose, nutrients to the cardiac muscles. ज्यावेळेला हृदयाच्या स्नायूंना योग्य प्रमाणात, पुरेशा प्रमाणात ऑक्सिजनेटेड ब्लड, शुद्ध रक्तपुरवठा होत नसतो, ऑक्सिजन पुरेसा मिळत नसतो, न्यूट्रिएंट्स, ग्लुकोज पुरेशा प्रमाणात पोहोचत नसतील, त्यावेळेला that person has a feeling of strangling of chest. There are pains in the chest region and it is oftenly referred as the angina pectoris. Now it is mainly due to the obstruction or spasm of coronary arteries. प्रामुख्याने ज्या वेळेला coronary arteries आता आपण पाहिलं, these coronary arteries they supply oxygenated blood, pure blood to the heart muscles. So whenever there is any obstruction or spasm of coronary arteries, then the cardiac muscles, heart muscles cannot get sufficient oxygen, cannot get sufficient nutrients as well as we can say glucose, and thus that individual has such type of feeling of pains. Angina pectoris is characterized by the chest discomfort, and this chest discomfort, I mean the patients of angina pectoris, they oftenly complain for chest discomfort. It is characterized by chest heaviness, chest pressure, burning sensations in the chest or heaviness in the chest, etc., etc. And oftenly it is associated with sweating, it is associated with breathlessness as well as nausea. Now the angina, it is not actually fatal, means immediately due to angina there is no death. During angina pectoris, though that person has a very severe pains in the chest region and that pains may be experienced by that person in the epigastrium, that is in the upper anterior abdominal part, as well as in the neck region, in the lower jaw, shoulders, especially in the left shoulder and also in the left arm. The angina pains are experienced by the person mainly during the exercise, during exertion or emotional stress. Because during exercise, during exertion, the heart muscles require more and more supply of oxygen, more and more supply of nutrients, and whenever this demand of more oxygen and nutrients not get fulfilled, then that person feels such type of pains. Of course, the angina can be relieved even by rest or by taking different blood thinning medicines. So here we have discussed the meaning of angina pectoris. Now let me tell you which are the different causes, which are the different factors mainly responsible to cause the angina pectoris. So let us talk about the major risk factors for angina pectoris. First one is age. In case of men more than 45 years, the men with 45 or more than 45 age are considered to be more susceptible for angina pectoris, as well as it is true for women. But there are more chances of angina and different heart problems in men rather than in women. Second, smoking. We know that smoking, that is inhalation of smoke of tobacco. The tobacco smoke contains so many different types of harmful components, and one of them is nicotine. Nicotine, it brings about the constriction of blood vessels, and definitely it affects the working of coronary system. So it is also considered as one of the cause of coronary artery diseases. Next, diabetes mellitus, sugar diabetes. Fourth, atherosclerosis. It is the main cause of coronary artery diseases. We have already studied. Atherosclerosis means there is deposition of fat, cholesterol or other substances in or on the wall of arteries. And here, whenever there is a deposition of fat or cholesterol, that is the formation of plaque in the coronary arteries, definitely it brings about the narrowing of the lumen of coronary artery, and it leads to the improper supply of blood to the heart muscles, and subsequently it leads to the coronary artery diseases, that is angina pectoris. Atherosclerosis याचा अर्थ काय होतो हे आधी आपण शिकलेलो आहोत. Atherosclerosis या डिसीज मध्ये coronary arteries किंवा कोणत्याही इतर arteries मध्ये कोलेस्टेरॉल, फॅट्स हे जमा होत जातं, की ज्यामुळे आर्टरी मध्ये असणारी ल्युमेन, कॅव्हिटी, पोकळी हे अरुंद होते आणि पर्यायाने विशिष्ट भागाला रक्तपुरवठा अपुरा प्रमाणात होत असतो. Now here, whenever there is improper supply of blood, oxygen and glucose to the heart muscles, then it leads to the cap. Next risk factor is obesity, that is excess of weight. Next one, any family history. Also we can say that the physical inactivity, those persons who does not perform any regular physical activity, exercise, they are also considered susceptible for coronary artery diseases. Next, kidney disease and prolonged emotional stress. So all these are considered as different risk factors for angina pectoris, for CAD. So here we have discussed briefly about the angina pectoris. Now let us talk about the second coronary artery disease, that is heart attack, which may be referred as the myocardial infarction. Let us talk about it. Silent heart attack. When a clot or thrombus is formed in the coronary artery, listen carefully. When a clot or thrombus is formed in coronary artery, it suddenly stops the supply of oxygenated blood with oxygen and nutrients to the heart muscles, and therefore the heart muscles cannot get enough blood, enough oxygen, nutrients, and therefore it leads to the heart attack. अर्थात अचानक जर करोनरी आर्टरीज मध्ये एक किंवा अनेक करोनरी आर्टरीज मध्ये जर रक्ताची गुठळी तयार झाली, काही ब्लॉक निर्माण झाला, इस्पेशली इन द नॅरोड आर्टरी, ज्या आर्टरीज अतिशय नॅरो आहे त्या ठिकाणी जर अचानक थ्रॉम्बस निर्माण झाला, गुठळी निर्माण झाली, अडथळा निर्माण झाला, तर डेफिनेटली द पार्ट ऑफ हार्ट वॉल or heart muscles beyond that clot cannot get sufficient blood, cannot get enough supply of oxygen and nutrients, and thus that part which cannot get sufficient oxygen and nutrients is damaged and it is referred as a heart attack. It may be referred as coronary thrombosis. Thrombosis, this word stands for formation of thrombus, that is clot, coronary arteries मध्ये अडथळा निर्माण होणं, or it may be called as myocardial infarction. Myocardial infarction. Myocardial ischemia and myocardial infarction, these are two different terms. Myocardial, this word stands for the muscles of heart. Myos stands for the muscles, cardiac stands for the heart muscles, हृदयाचे स्नायू. Ischemia means not getting sufficient supply of oxygen and nutrients to the cardiac muscles. ज्या वेळेला तात्पुरत्या स्वरूपात हार्ट मसल्सला, कार्डियाक मसल्सला, हृदयाच्या स्नायूंना रक्त पुरवठा व्यवस्थित होत नसेल, ऑक्सिजनचा व्यवस्थित पुरवठा होत नसेल, तर त्या कंडिशनला म्हटलं जातं मायोकार्डियल इस्चेमिया. अँड इफ देयर इज परमनंट or for a long time no proper supply of oxygen and nutrients to the heart muscles, it lead to the death of heart muscles. This is known as the myocardial infarction. This is known as the heart attack. Now the heart attack is characterized by breathlessness, chest discomfort, chest heaviness, nausea, vomiting, sweating, etc. etc. अर्थात मायोकार्डियल इन्फॉर्क्शन किंवा हार्ट अटॅक यामध्ये त्या व्यक्तीला प्रचंड अशा वेदना होत असतात, स्वेटिंग होत असतं, त्याचबरोबर नॉशिया, वॉमिटिंग या प्रकारचे लक्षण त्याला त्या ठिकाणी दिसत असतं. अँड of course the myocardial infarction, heart attack, severe heart attack is always fatal, means it can cause the death of that individual. But sometimes the patient in silent heart attack experiences the chest discomfort but does not show the classical symptoms of severe heart attack, and therefore there is always a confusion whether it is a heart attack or simply it is the chest discomfort because of any other reason. अर्थात काही वेळेला सायलेंट हार्ट अटॅक मध्ये त्या व्यक्तीला प्रत्यक्ष सिव्हिअर हार्ट अटॅक सारखे लक्षणं दिसत नाही आणि त्यामुळे हे निश्चित सांगता येत नाही की हा हार्ट अटॅक आहे, दुसऱ्या कुठल्या तरी कारणामुळे त्याला चेस्ट डिस्कम्फर्ट होत आहे. सो हियर सिम्पली वी हॅव डिस्कस्ड अबाउट टू डिफरंट coronary artery diseases. First one, that is angina pectoris, and second, silent heart attack. Now we people have to discuss about third and little topic, that is angiography. Angiography. First of all, let me tell you the literal meaning of this term. Here, angion stands for blood vessels, and graphy stands for to record. Now, what does it mean, and how is this technique? That we are going to discuss here in detail. First of all, let me tell you that angiography is one of the diagnostic technique, and it was first of all developed by scientist Moniz. Now, what is angiography? Let me tell you. Angiography, it is a highly advanced technique used for the study of flow of blood through the blood vessels. Try to understand. I said that angiography, it is highly advanced technique used to record, used to study the flow of blood through the blood vessels, especially through the arteries, and that's why the angiography is also known as arteriography. It may be called as the cardiac catheterization, or simply this technique is also known as heart cath, that I will repeat after some time. Now, I said that angiography, it is a technique in which the flow of blood. Angiography, it is a technique used to study the flow of blood through the blood vessels. Means through this technique one can know, one can understand about is there any obstruction in the blood vessel, is there any blockages in the blood vessel, in the artery, or it helps to know, it helps to study the size of diameter of lumen of that artery. Angiography ही डायग्नोस्टिक टेक्निक आहे, अतिशय ॲडव्हान्स्ड अशा प्रकारची डायग्नोस्टिक टेक्निक आहे की ज्यामध्ये रक्तवाहिन्यांमधून स्पेशली आर्टरीज मधून होणाऱ्या रक्तपुरवठाचा अभ्यास केला जातो. अर्थात त्या आर्टरीमध्ये, त्या ब्लड वेसलमध्ये, त्या रक्तवाहिनीमध्ये कुठे अडथळा आहे का, किंबहुना त्या आर्टरीची लुमेन आतली पोकळी ही अरुंद झाली आहे का की नॉर्मल आहे, याचा अभ्यास या टेक्निकच्या आधारे केला जात असतो. नाउ फर्स्ट ऑफ ऑल लेट मी टेल यू अबाउट द प्रिन्सिपल ऑफ एंजियोग्राफी. एंजियोग्राफी मागचं तत्व काय ते मी सांगतो. आय सेड रिपीटेडली that angiography, this technique is used for the study of flow of blood through the blood vessel, and in this technique continuously the X-ray images, X-ray photographs of the blood vessels are taken. It means X-ray imaging is carried out. X-ray photographs are taken with the help of an instrument known as fluoroscope. Now, during angiography, the dye, that is an intensifier known as contrast material, dye or contrast material, it may be known as intensifier, it is filled into the blood vessel so that the blood vessel of that particular region appears more darker than the surrounding tissue, and its X-ray photographs are taken for the study of flow of blood through the blood vessel. Generally, the dye or contrast material used is bismuth containing compounds or barium sulfate slurry or water soluble iodine dye. So these materials are used as an intensifier, as dye during the procedure of angiography. Now let us talk about the working of this technique, angiography. Actually, the angiography, it is not highly painful or highly uncomfortable procedure. But then and then, in hypersensitive patients, either intravenous sedation or say local anesthesia is applied. Angiography technique ही खूप पेनफुल अशा प्रकारची प्रोसिजर नाहीये, खूप त्रासदायक अशा प्रकारची प्रोसिजर नाहीये. तरी सुद्धा जे पेशंट्स हे हायपरसेन्सिटिव्ह असतात, अतिसंवेदनशील असतात, त्यांना एक तर लोकल अनेस्थेशिया दिला जातो. याचा अर्थ ज्या शरीराच्या भागामधून कॅथेटर म्हणजे काय आता मी सांगणार आहे, ही शरीरात इन्सर्ट केली जाते, तेवढ्या भागाला लोकल ॲनेस्थेशिया दिला जातो, तेवढा भाग हा बधीर केला जातो, त्याला भूल दिली जाते किंवा सिडेशन दिलं जातं. याचा अर्थ तात्पुरत्या स्वरूपात त्या व्यक्तीला गुंगी येईल, झोप येईल, अशा प्रकारची व्यवस्था केली जाते. अँड देन दिस प्रोसिजर इज कॅरीड आउट. नाउ द लॅब or room in which angiography is carried out is known as cath lab. ज्या रूम मध्ये एंजिओग्राफी केली जाते त्या रूमला कॅथ लॅब असं म्हणतात. And angiography is carried out by well-trained cardiologists along with other technicians. Now, in this cath lab, it requires the different instruments, it requires different necessities, such as first of all fluoroscope, that is nothing but the camera with X-ray films. Second, it requires the catheter. Catheter is nothing but simply very thin and elongated hollow tube with a diameter of just 2 to 3 millimeter. कॅथेटर याचा अर्थ ही लांबच लांब नळी आहे जिची डायमीटर ही फक्त 2 ते 3 मिलीमीटर असते. अशा प्रकारची ही थिन अशी ट्यूब या ठिकाणी वापरली जाते. हाऊ इज द यूज ऑफ दॅट कॅथेटर? आय विल टेल यू. In addition to that, it requires different heart monitoring instruments, heart monitors, also other emergency equipments, etc. Now let us talk actually about the technique. During angiography technique, initially the catheter is inserted through the skin, mostly at the groin region. Here I am going to draw a diagram for our correct understanding. Now suppose here is a groin region. I said just now that during this technique a thin tube, that is catheter, it is inserted through the skin from this groin region into the artery. Now consider here is supposed to be the catheter and it is inserted in the skin from this region, okay, that is groin region, and this catheter is slowly guided and advanced and its continuous monitoring is carried out with the help of fluoroscope, with the help of X-ray viewing machine. अर्थात ही कॅथेटर जी आहे लांबच लांब थिन अशी जी नलिका आहे ती ग्रॉइन रिजन जांघेच्या भागामधून इथल्या आर्टरी मध्ये इन्सर्ट केली जाते आणि नंतर ही कॅथेटर ही पुढे पुढे ढकलली जाते आणि तिचा मार्ग हा फ्लोरोस्कोपच्या मदतीने हा कायम तपासला जात असतो. नाउ व्हेन that catheter reaches at the particular position, say as far as concerned with coronary angiography, याचा अर्थ coronary artery ची जर angiography करायची असेल तर ज्या वेळेला ही कॅथेटर, कल्पना करूया की या ठिकाणी हार्ट आहे आणि आपल्याला माहित आहे हृदयाला रक्तपुरवठा करणाऱ्या ज्या रक्तवाहिन्या त्यांना आपण coronary arteries म्हणतो. So whenever this catheter reaches at the base of coronary arteries, ज्यावेळेला ही कॅथेटर coronary arteries च्या बेस पर्यंत पोहोचते, at that time the dye intensifier, I said contrast material, ज्याला आपण डाय म्हटलंय, कॉन्ट्रास्ट मटेरियल म्हटलंय, ते या कॅथेटर मधून आतमध्ये इंजेक्ट केलं जातं and of course that dye when get released here from this catheter, it fills up that coronary arteries, it fills up that particular blood vessels in specific area, because of which that blood vessels as get filled with dye appear more darker than the surrounding tissue. मी असं म्हटलं की एकदा ही कॅथेटर योग्य ठिकाणी पोहोचली, समजा या ठिकाणी करोनरी एंजिओग्राफी जर करायची असेल तर करोनरी आर्टरीजच्या बेस जवळ ज्या ठिकाणाहून करोनरी आर्टरीज उगम पावतात तिथपर्यंत ही कॅथेटर पोहोचल्यानंतर या कॅथेटर मधून तो डाय इंटेन्सिफायर आतमध्ये इंजेक्ट केलं जातं आणि मग ती डाय या ठिकाणी करोनरी आर्टरीज मध्ये भरली गेल्यामुळे that coronary arteries appear more darker than the surrounding tissue and its X-ray images are taken continuously आणि त्याचे X-ray photographs हे continuous घेतले जात असतात. Now that X-ray photographs are actually called as angiogram or angiographs and with which one can understand whether there is a smooth supply of blood through that blood vessels or is there any obstruction, is there any blockage, on the basis of which the further treatment is decided. So here I told you about the basic technique of angiography. Now this angiogram, that is X-ray images of the blood vessels, are used for further treatment. Say as far as concerned with the coronary arteries, if any blockage is there, then with the help of angioplasty, a stent, it is nothing but a small spring like structure, a small spring like device, it is placed here in that narrow region so as to dilate, so as to increase the diameter of that coronary arteries in that region for the smooth flow of blood, or in some cases if the angioplasty is not possible, then bypass surgery is carried out, in which a blood vessel is grafted in this manner. It means a new blood vessel is grafted in such a way that there should be a smooth flow of blood through this newly grafted blood vessel, and the damaged part or affected part can get the blood, oxygen and nutrients. So here we have discussed briefly about the technique of angiography. So let us stop here today. Thank you and bye.